Hi, I'm Dr. John Young with Foundational Health Center here in Largo, Florida. And today we're going to be talking about the perfect diet. And I hope at the end of this, you're not going to throw rotten tomatoes at me. I see patients all the time, and it's very interesting, especially with a new patient. They will often come in and say, John, listen, I eat very, very healthy. I just want, maintain my health and all of that. But I just want some advice from you because I eat very healthy. I drink, very pure water, filtered water. I eat only pesticide-free, organic fruits and vegetables, range-free chicken, grass-fed beef, wild-caught salmon. I am very clean in my diet. And so I then will say, but now you say you're also suffering with some GI problems or some fatigue, different things that they eventually come out and say, well, I've got these little problems that turn out to not be so little. And I tell them, I don't know what kind of dietary advice you want from me because, it sounds like you're eating so-called healthy. But what may be healthy for one person may be the kiss of death for another. It's very interesting. I have people come in and, we'll talk about some kind of illness they're having, and they'll say, John, years ago I had this terrible infection. I took penicillin. It saved my life. And then I say, yeah, I'm so glad that worked. But, I have a friend of mine and his son died because they gave him penicillin. He had a terrible allergic reaction and died. So what is good for one person may not be good for the other person. I have people tell me all the time, I take methyl B12. And for a lot of people, methyl B12 is just great. I gave methyl B12 to a patient of mine recently, and he had seizures. So we did some genetic testing on him, and turns out he has a MTHFR defect, which a lot of people are aware of. You need methyl groups. But he also had a TCN2 genetic defect. And so we stopped them. We gave him very low dose methyl B12, but we gave him adenosine hydroxy because genetically he cannot get B12 into a cell. We knew that from doing the genetic workup on him. And so what we did is to get a B12 that would go into the cell, it's adenosine hydroxy. So, and he was just like, couldn't quite figure that out. But I have an MTHFR. I must need all these methyl groups. But when you start to break down people genetically, you realize that what is good for one person may not be good for the other. And giving him adenosine hydroxy worked, and he went from a wheelchair to walking in about 5 weeks. His B12 was that bad. I've had patients who, in fact, I had a lady just yesterday tell me, that, John, remember you told me to stay away from overseas produce, fruits and vegetables from anywhere outside the U.S. I did it. My husband and I feel great. I told it to my daughter. She stopped overseas produce. She feels wonderful now. Because overseas, they use a pesticide that's outlawed in the U.S. And for a lot of people, that pesticide really affects their immune system. And so it is kind of a broad idea that there is a healthy diet out there. There is no such thing as a healthy diet. There's some basic things I think people need to look at is staying away from the pesticides, staying away from a lot of processed foods. But it really becomes an individualized situation. Is there any test out there that I suggest? I have used the ALCAT test, which looks for delayed allergies, which you see in a lot of patients, and you pick up some of these chemicals that we're allergic to. But the other thing is you may want to do some genetic testing. We've used 23andMe, we use the Stratagene, which I think is a better test because it looks at more gene. And that will give you a better idea of just what foods or things out there may not work well on your genetic profile. ALCAT, any type of delayed allergy test, also some type 1 allergy testing is also good. But the idea that there's a healthy diet or you're eating a healthy diet, it really is very individualized. You know, what's the perfect height? Well, for me, I think it's 6'6". My wife thinks it's about 5'5". So it's very individualized, and we in medicine are just into this idea of just, you know, there's one size fits all. It's not true. So if you're looking for a really healthy diet, you may want to talk to your doctor about doing some genetic testing, Strategene, 23andMe, doing delayed allergy testing, ALCAT. But remember, there is things that only you do well with, and that can take some effort, do some special testing to find out what diet works best for you. And you know what's interesting is the patients, when they do a lot of this stuff, they come back and say, John, I feel great. Talk to you later.